One of the most common dosage forms that we compound in our compounding lab are transdermal drug delivery systems. Transdermal means across the skin. So whether it's a pain gel for a human, or we're going to talk today about the transdermal drug delivery for veterinary patients, mostly feline. So what's harder to do than giving a cat a pill? I don't know that there is anything harder than that. So it's very, very common for us to work with veterinarians locally across the state to deliver drugs across the skin. Typically that's delivered in the ear. So we're going to talk about that. These gels are packaged in a patient-resistant package. They're packaged in very sophisticated delivery systems. These are used by clicks. So a click is a dose. I'm going to use a demonstrator to show that. These are always dispensed with plenty of finger cots to put on your fingers, so you're protecting yourself and making sure the animal gets all the medication. So let's look at what that looks like. This is a demonstrator pen. The finger cot's going to get rolled onto the fingertip, and the medication, this spins off. The medication then comes out of the tip, and that's by clicks. So 2 clicks is typically a dose. 1 click, 2 clicks. So then we're presenting the measured medication dose for that animal. We wipe that off, and then that medication is rubbed on the inside of the ear just below the fur line. So you want to make sure you get to bare skin. You don't want to go too deep. Sometimes people have to clip the hair a little bit so there's a real bare spot. But then that cream, you rub the cream between your finger and thumb with the pet's ear between. So that's rubbed into the ear thoroughly, and the movement of the cream releases the medication. So 2 things happen. The rubbing creates friction. That creates blood flow into the ear. The rubbing also breaks the drug free from the transdermal matrix, and on the skin, then that's delivered into the animal's bloodstream. Super effective. Not all drugs are going to work. Sometimes drugs are too large, but some very, very sophisticated medications work. We do some pain gels. If a cat's had an accident, we've done quite a bit of work with some injuries with especially the Humane Society, where we're healing wounds with topical gels, but we're also delivering pain medication transdermally through the ear. These animals are hurt, they don't want to eat, they don't feel good, it's hard to get a medication into them. We deliver that through the ear. So again, the finger cot's important. You want to make sure that you protect yourself from the drug, but you also want to make sure that your pet gets all of the medication. Because if you don't put that finger cot on and you're rubbing that in with a bare finger, you're going to absorb some of that, so your pet's not going to get the full dose. Finger cot, click, prescribed medication onto that, rub down into a bare spot in the ear, rub it in really, really well. If you have other cats in the house and they do some ear cleaning, you just have to wipe that area clear. Sometimes you'll get a little crusty film after a few applications. Again, it's just a cleaning. Cats sometimes clean their ears, sometimes you have to clean it for them. And then switch back and forth. So if you're doing a twice a day dosing, left ear in the morning, right ear at night. If you're doing it once a day, right ear in the morning, left ear the next day. So you want to try to rotate that. That's transdermal drug delivery in the feline population. Very, very popular. And our vet prescribers really love it. If you're interested or you have a companion animal that you think might need our help, please give us a call or stop down at Dakota PrecisionRx Labs and give us a visit.